And Martin, go ahead.
Okay. Thank you, Ava. Hi, my name is Martin Reynolds, and I'm the co-executive director of the Maynard Institute for Journalism Education, the oldest journalism nonprofit dedicating to helping America's newsrooms reflect the diversity of the nation. Thank you for joining us today for this webinar. I want to thank our guest, John Eligon from the New York Times, and of course, Jean Marie Brown, who is a fault lines guru and our colleague and a renowned trainer of the fault lines framework. I just want to remind folks that we want to hear from you, so please plan to put your questions in the chat, and then we will grab from those after the discussion. You'll all be muted now, and given the size of the number of folks on the webinar, obviously, we don't want to have a bunch of crosstalk, but we do want your contributions, so do share those questions, and we're looking forward to a very robust discussion. Somebody's saying that they can't hear anything. I'm not sure why they can't hear it, but we'll just figure that out. So,
and in the lower left, there's a thing to turn on your microphone. That I had to do that, so maybe that could be it.
But you all can hear me though, right? Can you all hear me? Yeah, okay, great. All right, so I'm not sure what's up with that person. So please submit, thank you very much for that, Nick. Please submit your questions on the chat, and we'll just start with the conversation. So I'm gonna have Jean Marie, who will introduce our guest. I just wanna, on behalf of the Maynard team and my co-executive director, Evelyn Sue, who's on the line as well, we welcome you and hope that everyone is safe. And I guess the good adage that Evelyn told me the other day, which was stay positive and test negative. So with that, I wanna hand it over to Jean Marie Brown to introduce our guest and start the discussion.
John, thank you for agreeing to come on with us today. I know you've been covering race at the New York Times since 2014, and before that you were actually covering the Ferguson riots, and that this kind of your beat emerged out of that. How did covering race for the last 6 years prepare you for what you're doing now with COVID-19?
Yeah, well, I guess I would say, first of all, thank you for having me, and I'm glad to be here with you all. And I would say, while my formal beat on race started in, 2014, really it's kind of been a part of all my coverage before then, because, no matter what you're covering, I covered the courts at one time when I was in New York, when I covered just kind of the Midwest as a region when I first moved to Kansas City, where I'm based now. And, there's stories of race in kind of everything, it kind of infiltrates our lives in many ways. So it's basically having the ability to pick out those stories. That's kind of one reason that the beat for me has been very interesting and very powerful, and something that I've really been fascinated with. But essentially having focused on race as a beat and in my coverage before that, it really helped me to understand a lot of the fault lines and the different ways that race play out in society in normal times. And as we're seeing now, the way that race plays out in normal times, it's only kind of exacerbated or enhanced when you have times of crises and whatnot. So I think it really allowed me to be able to see, what racial dynamics were at play and what racial dynamics would then be affected and impacted once it came to an outbreak. And I'm happy to, I'm sure we'll talk some more about the specific stuff that I've done. But yeah, that's basically what really helped me coming in to understand the racial fault lines even before this outbreak became what it is now.
As the outbreak started in the earliest days, in January, a lot of it was geography and race. And if you think about China, but there was also the element of class with the whole, if you're on a cruise ship, you're in danger, but who's on a cruise ship?
Yeah.
Were you surprised, or were you anticipating that this was going to play out racially?
Yes, I would say I was. First of all, as you said, looking at it first being in China, even if you look at some of the stories that my colleagues did over there, you had some of the migrant workers, from the Hubei province, which is where Wuhan is, who were all, already kind of on the margins of society there, who were already seeing just this increased discrimination. And these are the folks on the lower end of the socioeconomic ladder in China, and you saw it playing out there. So you can only imagine, we have those same fault lines that are socioeconomic and racial here in the United States, that those things would play out. And so the first story that I did about the coronavirus was in early March, actually. As I saw, we were seeing a cluster of infections in Washington, and we were seeing it in California. And knowing that there have long been racial disparities in the healthcare industry and in access to insurance and access to medical care and the treatment that African Americans often receive when they go to get medical care. And looking at the history of it, whether it be Tuskegee experiments or other ways in which Black bodies were often used, as experiments, as guinea pigs in a way. You could just see kind of all the makings for what this could mean if there is an outbreak and if people need quick access to medical care, if people need, if people's life depends on their existing health conditions. So I actually did a story where I went out to East Oakland and spent some time at a public health clinic there and spent some time with some of the medical professionals who were already treating a population that was very vulnerable, and to talk to them about, what they foresaw or what they think would be coming if there is an outbreak in that community. And what I really saw was, this sense of real concern, that, you already have high rates of asthma. I went out with a respiratory therapist who makes the rounds in different communities. And you already have a lot of folks who are who have transportation issues. They may not have cars. They often ride the BART, which is the public transit out there in the Bay Area. And those are all things that make it put you more in public spaces, that make you more susceptible to contracting the virus and contracting things like that. So you have this instance where you have communities in which health outcomes are poor, people are reliant on public transit and kind of like being out in public spaces where the virus spreads. So you kind of have this kind of brewing storm right from the start. And so that was like my first story getting into it. And then from there, we started to see, beyond the medical ramifications, that there's also economic ramifications, because, the country started to shut down and, people started fleeing their offices. But, one story I did was looking at, when everyone was fleeing their offices, then what about the folks who were going in and cleaning those offices? And those happened to be mostly Latino and Latina immigrants who were going in as the janitorial staff for a lot of these offices. And in some cases, they were not even being told of the risks that they were facing. They weren't being told that there were people in that building who either tested positive or were exposed to the coronavirus, but they were just being kind of sent in blind. And in some cases without the protective equipment, which is still very hard to come by. So you kind of start with, the medical part of it. And then you see as it became an economic crisis as well, you saw that having also the same ripple effects throughout communities of color.
So what was kind of the response when you got into communities of color? There is this narrative right now that communities of color are resistant to social distancing, or that they're all out, everybody's out having a party, or everyone's having a great time. Is that a valid narrative, or is that kind of feeding into a stereotype?
I think to say communities of color are resistant to social distancing, I think that is a false narrative. I think that there are communities that are resistant to social distancing, and I don't think that is limited to communities of color. I mean, you need to look no farther than I think it was the governor of Oklahoma. He put a picture on his social media accounts of him at a bar. This was in kind of the days that things were starting to shut down, and we were seeing statesmen and local officials move to limit the amount of people gathering in places. He put a picture of himself, and he's white, and he put a picture of himself in front of in a bar in Oklahoma City that was, packed with people, So I think you see this resistance. And yes, does it happen, in Black communities in Detroit, where I'm at right now? Did they have people who were still playing basketball and partying in parks? Yes, they were, and that's been an issue. So but I think that's been an issue across the board. So to limit that to African American communities or Latino communities and whatnot, I think that's a very dangerous thing to do. And then I guess the other point I would make on that, and we've covered this in the Times, and other outlets have written about this, but social distancing is also, it's not a choice that everyone can make, right? There are people with housing instability. Those are disproportionately Black and brown people that are affected by that. The jobs that we can't do from sitting in our computers like we are right now, there are people, disproportionately Black and brown folks, who are doing those jobs that, you have to go out to, you can't clean a building with your computer, right? So there are these jobs in which Black and brown people are overrepresented, and so they have to put themselves in harm's way. And that's one thing I'm happy to talk about this more later. But, in Detroit now, one of the stories I did, I rode a bus there. I rode one of the bus lines and talked to a lot of people who got on that bus, and so you have these instances where folks are in situations, whether that be financially or just the circumstances of the community in which they live, where social distancing is not necessarily a viable option in the same way it is for some of us who do have, are blessed to work jobs where we can work from home, or we do have stable housing, period, And I'll just give one quick example. Detroit, I was working on a story this weekend, and so I went driving around in the neighborhoods. And honestly, so downtown, where it's like most of the quote unquote revitalization has happened, where you have, new businesses, restaurants, and things like that. That it's pretty empty, pretty clear. I'm staying downtown in a hotel. Not really much going on, but as you drive out into the communities where folks live, where their housing and stuff is, it was, now I used to live in Detroit, but it's been some years now, but so it's probably not as busy as it would be if there were not a stay-at-home order, if there were not a pandemic going on right now. But still, if you were to come down from outer space and just land there, you wouldn't really know that there was something going on, right? I saw people kind of like, out and about. People were at the gas station. Some people were in their front yards doing things, people walking up and down the sidewalk. You did see more people out than you would maybe think or would have liked to have seen. But then I spoke with an editor of mine in New Jersey, and kind of, nicer kind of, upscale New Jersey. And he talked about, yeah, we had a lot of people out. People were in their yards gardening, And so all that is to say, you see that there are differences, like what it means to be outside if you live in a stable community with good housing, big yards in suburban New Jersey, versus if you're in Detroit, where, your house might be the only one on the block that's occupied. You don't have that luxury of like your outdoor time can't just be sitting in your yard, because or even staying in your house could be detrimental to your health and detrimental to both your physical and mental health. So the way in which one interacts with their communities is going to be different depending on your class and where you live and things like that, and those things inevitably skew toward race as well. So that's just a long way of saying that, the way that you social distance depends on many factors, not just one's individual choice.
Right. What about I guess to go into this a little further, the whole illicit behavior narrative, and I guess the Surgeon General kind of was saying don't drink and smoke, and the suggestion, and now that the numbers are spiking, that somehow it's Black people's fault that this is happening.
Well, I think it's, again, any sort of pointing to the finger to one group or one community and saying don't do this or don't do that is really oversimplifying it. Are smoking rates too high in certain communities and stuff like that? Then yeah, those are definitely factors. But you can't look at that but also ignore kind of the structural inequalities that have existed that put Black and brown people at greater risks for some of these health issues. And when we're talking about COVID-19, it's mostly respiratory issues, right? So we look at, if you go way back to, to the history of, how some of these communities were formed and how people ended up living where they are living and how we ended up in a society that remains largely segregated, it was because you had folks who were not allowed to move into certain communities, who were restricted to certain places. And those places tended to be the places that were disinvested, where people could not, get jobs, where they were not given loans and stuff for their housing. And they tended to be in places that were more easily located, near factories and different things that present environmental hazards. So those things all factor into, these rates of asthma, these rates of obesity when you can't have, healthy food or you don't have easy access to grocery stores and whatnot in your community. So I think these are all things that, like, any sort of whether it be a surgeon general, a public official, or a journalist, to oversimplify and to just look at one thing would be doing a disservice and is really dishonest to the true underlying causes that are causing Black folks to really die at higher rates, is what we're seeing now, and in some ways catch the virus at higher rates as well.
So when things stabilize, I'm not going to say go back to normal, because that doesn't exist.
Yeah.
But when things stabilize and we start looking at society, what are some of the areas that journalists should look at when it comes to questioning why things happened in certain communities, why some people were affected more than others. What are some of the systemic or structural issues that we need to kind of think about?
Well, the first thing, when this is all, stabilized, as you said, and hopefully at that point we'll start getting back better data. States, these overwhelmed public health officials will start having time to really sort through the data and give us an analysis and then start to do more testing, on blood, on antibodies and stuff like that to figure out, many of us are probably carrying it and we have no clue that we are, once you're able to do better testing throughout, a wide swath of communities, whether that be, black, brown, white, whatever communities you go into, and you're able to figure out, how many people were tested, who was actually carrying it and whatnot, then you can start looking at mortality rates. So who's dying from the coronavirus? There are people dying who probably don't know they have it and then never knew they had it and they're dying at home, So I think the first thing is really digging deep into the numbers and seeing what that tells us. Like the reporting we've done so far is based on a very incomplete, though but it's no less, startling, but it's still incomplete picture of the racial disparities that we're seeing so far. But once we have that full picture and figure out who's dying, and then I think that gives us a starting point. And from there, I would really want to look at, let's look at some of these cases of people who died, and what sort of access did they have to healthcare pre-coronavirus? What sort of access did they get, when the coronavirus was happening? I'm interested in getting into some of these medical facilities, like which ones were the ones that were most overburdened, who had to travel the farthest to get to their medical centers, who even had access to medical centers, who was able to call doctors and get diagnoses, because the way it's, I know at least in the early days, I remember when I was doing some reporting in California, they say to even get tested, they will always say, oh, call your primary care physician first. But, a lot of folks don't have primary care. They go to the ER whenever they're sick and whatnot. So it's really looking at, I'd be interested in tracing and tracking some of these cases of people who died to kind of see what hurdles they went through and how does that compare to other communities that are demographically different, that may have more wealth and more affluence. Did they have to go through some of those same hurdles, or were those different? So that's one thing I would like to look at. And then on the economy side, again, just like we were talking about the underlying health conditions that affect Black and Brown communities, in times of when it's not a pandemic, those also affect them even more in a pandemic time. I think we have to look at that with the economy too. So historically, Black-owned businesses have had a more difficult time with getting funding, getting capital that helps to get them off the ground. So when this economy starts to try and climb out of the hole that it's going to be in, what is happening with those businesses that are already undercapitalized, that are already underfunded, that are already at a disadvantage? So I want to know what's happening with those with those businesses, and what about those workers, those who are overrepresented in these fields that are hourly wage workers, many of whom either their companies stepped back or they lost their jobs now. What is what is their fate right now in terms of getting back to work? And then one other area, there can be many areas, right? But one other area that I would be interested in is the jail population, the jail and prison population, because we're seeing a lot of obviously Black and Brown people are overrepresented in jails and prisons, and we're seeing a lot of movement toward releasing folks now because of the health crisis and the way it's spread in jails. In Cook County, Illinois, and Chicago, it's one of the biggest outbreaks is there in that jail. So I talked to some folks who have been working on jail and prison reform issues for a while, and they say what they hope that people see in this time is that when you release especially low-level offenders, people who are not considered a quote-unquote violent threat to society, you're going to see that this does not make it's not going to be a free-for-all. It's not going to threaten our public safety, because these people should not have been in jail in the first place. So how is this going to fundamentally alter, if at all, the way that we think about the criminal justice system and who gets locked up and for what? And maybe it will go back to being the same. Maybe it will go back to being worse. Who knows? But these are things that I would definitely look at. And then just one more point. It was an interesting point raised by the county executive in Jackson County, Missouri, which includes Kansas City, which is where I live. He raised the point that while it is good to have the data by race, so you could kind of address those disparities of who tests positive and who dies from COVID-19, he was concerned that could be another stigma to some of these communities where, you get the predominantly Black populations in Kansas City area. So he kind of wondered out aloud whether this would be in some ways another form of another thing to redline Black communities with, to ostracize Black communities. And I hadn't really thought about it that way, but that is an interesting point. So what is this going to mean for those communities that already, been through hardship, that already disinvested? What is this going to mean for those communities going forward? How are they going to bounce back, rebuild, and are they going to have another stigma to live with now? So that's those are probably the things that I would really look at once this stabilizes.
Okay. We got a question here I'm going to read to you. When people say communities of color are resistant, is that all stemming from the fact that it is very typical for Black and brown communities to live in intergenerational households, and that many of those people will be essential workers? So it will look like there's a ton of people at home, but then a ton of people coming and going. So people who don't understand or don't even consider that are misinterpreting what is actually happening and then spreading the false narrative that Black and brown people aren't listening.
Yeah, that's it. I hadn't thought about that. That could be one that could be one reason. But the thing I would say about that, I think oftentimes the people who make these assumptions are not even in those communities to see those households, to see, how many people are there, because oftentimes people make assumptions from afar, and then just the reality of this world is still, we're very much segregated in how we live by, race, class, and those types of things. So I wonder if some of those people who make those assumptions are even looking at that. And then the one other thing I will say about that too, that I guess I didn't mention before, is that there's also a very historically rooted mistrust in the medical system in Black communities, and rightfully so in some cases, with the Tuskegee experiment and other ways that Black and brown bodies have been used as guinea pigs in medicine. And not even that, but even if you look at something like Serena Williams, she almost died during childbirth because she her doctor downplayed her pains that she was feeling. So there's still a lot of racism that's documented and well noted in the medical system. So that could also lead to some of this distrust, and it could impact the behaviors of African Americans when it comes to how they interact with the medical system during this pandemic, and whether or not they trust it.
Okay. This is from someone who covers transportation in Seattle. We've written about people who are transit dependent. Do you have any thoughts on how to move those stories forward, potentially towards solutions journalism?
Yeah, that's a great question. I was actually trying to figure that out myself, because the Detroit piece I'm writing right now, kind of looks at that, and I'm hoping it takes readers on that bus so they really understand. I wrote a bus across Detroit, and that should be running hopefully in the next day or so. And I really wanted to take readers on that bus so they could kind of see, this is the reality for people. And I think, all I can say to that is what I heard from the people on the bus, especially the folks who are riding it to get to work. And their main thing, and then the bus drivers as well, because, there was a bus driver in Detroit who died. And so the bus drivers have been very concerned about this issue as well. But, what I heard from them is they want some sort of accountability for who's going to get on the bus. And, it gets tricky, right? Because there are some people who don't have housing, who are essentially homeless. For them, the bus is a respite. It's a place they can go and, get out of the elements, when it's cold in Detroit, or, get a place to sit down comfortably. So it's tricky, how do you then exclude certain people from the bus, when it's a public good, really, the transportation is. So I guess but to get back to your point, the solutions that I'm hearing from people who are riding it is in some way, limiting or restricting, or finding some way to manage who gets on the bus, maybe running more bus routes so that there are more buses, so that people don't have to wait as long, and not everyone has to get on one bus. Those are a couple things. And just, in terms of pushing the story forward as well, I read a very good piece in City Lab that, it doesn't necessarily get toward these solutions, but it does get towards something that I think is something that's noteworthy for exploration, is looking at the bus as transit as a public good, because right now it's looked at as ridership levels, and ridership is down, and how much revenue is that going to bring in? I think in New York, with the MTA there has been historically in shambles with being underfunded and behind, and everything's old and breaking down there. But how do you look at transit in a way that it's not looking at necessarily this is something that needs to make money for our city or things like that, but it's a public good, because the good point that the City Lab piece may raise was that the bus is essential not just for those workers to get to work, but it's for us too. It's for us who are ordering things on Amazon. Guess who I saw on the bus? I saw a guy who was going to Amazon to work, right? So he was putting our packages together. I just ordered DoorDash on my phone to get some food here. And who was that? It was one of the women I ordered from. I actually ordered it from the restaurant that one of the women on the bus that I met that she works at, you know? So the transit is essential for the public good, right? So that we can all, you know, continue to enjoy our lives and to live our lives in a certain way too. So I wonder if there's a way in pushing it forward to like think, does this change how we think about transit as well? And it'd be interesting in stories that would really explore that as a topic.
Okay. What about, how can news organizations cover more aggressively what's happening in detention centers?
Yeah, you know, it's funny. Right before I got on this call, I got an email or actually a Twitter message from someone who is studying, you know, the jail population here in Wayne County, which is, you know, Detroit, and that is really a challenge, right? Because inmates are, especially in this time, they're being isolated. They're kind of closed off from society in normal times, and now they're really being isolated. So I think getting at, you know, talking to inmates, talking to people who are there, talking to their families, the people who talk to them, and really understanding what they're going through. Because, you know, the stories that I've read on this, there are still some very concerned people. And I'm actually doing a story about inmate release, in which I talked to a guy who was released from a jail in St. Louis. And he talked about, you know, and there would be guards who would be clearly sick. They would be taken away and they would just disappear. And then they would ask, you know, what's wrong with him? And they wouldn't get an answer. Like, they wouldn't tell him, oh, they tested for the coronavirus. And there would be inmates too who got sick, and they wouldn't necessarily tell them or give them any information. And even things like bars of soap, they have to pay for soap, you know, in that jail. And so I think anything that really gets at what the experiences are of those folks who are in there, and you can get that either through their families, through, you know, maybe their families can help you get on the phone with them. Inmates who have just recently been released, you know, talking to some of them, and then kind of better understanding what's going on there. And you know, you have to also look out, you know, sadly we're seeing, you know, deaths happening in jails and prisons as well. It's happening on the federal level, it's happening on the state level, it's happening on the local level, you know. So what kind of health care is available to them in there? I got a call from someone, a source yesterday, about someone who's in a federal prison who has tested positive for the virus, and this person's being treated still in that prison. They haven't even shipped them off to a hospital or anything like that. So it's kind of those stories and illuminating the challenges of what life is like, you know, and how an already complicated existence is made even more difficult by a public health crisis like this.
Now, one of the earliest social effects of the virus has been the rise of anti-Asian violence.
Yeah.
How should journalists go about covering hate groups and how white supremacists are capitalizing on opportunities to try and isolate populations and stir things?
Yeah, I mean, I think, to me, the best way that you can always approach, you know, covering hate or that type of like vivid racism is by, you know, getting into those communities where it's happening, where they're affected. And I think we did see actually some very good journalism about this early on in this pandemic, and how Asian American communities were affected by this, how Chinese American communities were affected by this. And I think that's really a story that needs to be told very largely through the prism of those people who are suffering the hate, you know, in what ways they're suffering from it. And I think it's also important to contextualize it in the sense that you have dramatic, like, you know, extreme, you know, racist, you know, people who, you know, wave the Nazi flag, that type of thing. You have that type of stuff going on. They're very visceral. But you also have like the subtle things that are harder to diagnose. You know, again, in the early days of this, when I was in Oakland and the restaurants were still open, I went to what was a really good Chinese recommendation to me. Someone recommended a really good Chinese restaurant to me. I went in there. It was empty. It was just me and the photographer I was working with, and there were like two other tables, like, you know, taken. It was a huge like space. And I asked the waiter, like, what happened. He said, yeah, because of the coronavirus, you know, our business has been going down, you know. And And that was before stuff closed. And at that time, it was other restaurants were being patronized that were not Chinese restaurants, but that one wasn't. And so I think it's also incumbent upon us to not just look for like the extremism, the stuff that's easy to see, but in what ways are we all complicit in this, right? In what ways that might be more subtle is that hate still going through and still affecting communities of color and some of these marginalized communities.
Thinking about that, how do you go about covering poverty and spotlighting the people's struggles in poverty without victimizing them, without fetishizing their situation?
Well, I think one really good example of that was my good friend Robert Samuels, who works at the Washington Post. He did a story in Milwaukee about the racial disparities in COVID-19 deaths and infections there. And I think what he did really well is he showed really like why it happens, through transit, through all the usual suspects, through housing instability, through jobs that folks have to work. He really showed how it's kind of goes through the community, and also some of that mistrust that the community has in the medical system. So he did a really good job of that. But then he also framed it as like, here's this community and here's what they're doing about it. So he went out with a group that was doing like, I think some sort of like food pantry stuff. He spent time with a group that were putting together care packages for people in the community. And it really showed that, the way to battle this, like the solutions, of course you need help from, the federal government needs to provide funding and the testing, the state governments, the local governments need to do their role. But at the end of the day, what someone told me, one of the things that the same communities that are vulnerable, one of their greatest strengths is that they're also very strong communities generally. Like a lot of like Black communities that might be low income, might have those challenges. People are generally very like, everyone knows everyone there. People are tight knit. There's churches there that are kind of like anchors for the communities. So these are places these are things that can like kind of bring everyone like together and kind of help folks get beyond some of the challenges. And so I think highlighting that as well, in addition to like saying, this is why these are why the challenges why the challenges exist. I think it's important to say that and to point that out and to show that. But I think it's also equally as important to show how the community is fighting through that, and how they're, despite the lack of resources and funding that they're getting from the government that they really should be, that the government should be, testing people and should be, making sure that, folks have access to, to housing in case they have to quarantine and isolate and stuff like that. And not just showing, like where the government shortfalls are, but also showing like where the community is stepping in to try to pick up the pieces.
Okay. How can journalists better react to the gaslighting approach coming from the White House? The daily misinformation.
Yeah, I mean, yesterday was like classic. I mean, I don't know, for those who didn't see it, I'm sure we all read about it by now, but just in case you didn't, like the Trump, he put on early in the press conference, he put on a campaign style, some people say propaganda style video, kind of basically taking shots at the media and saying the media was wrong, and Trump's response has been great. And some of the networks, I was watching CNN and they cut away from it, and I understand MSNBC did. I'm not sure what the other networks did. But yeah, it's a challenging thing, right? Because on the one hand, like that is the office of the presidency, and people, the public should, be able to understand and turn to that, to that pulpit of the presidency to understand, what is going on, when help is coming, what steps are being made to, to get us to a point where we're stabilized. But on the other hand, if you just kind of just put the press conferences on and don't contextualize it, then you tend to fill a lot of people with misinformation, right? So I think one, it's incumbent upon the journalists in the room, first of all, and shout out to my girl Yamiche, who's gotten a lot of attention for her standing up to to Trump and his pushback, and really getting important questions out there that need to be answered. So I think first and foremost, it's the journalists in the room who have that chance to speak, and them really making sure that they are engaging in a way that that at least forces the issues out there. He may not answer the question, but if you get the issue out there, at least the public sees that. Like a good example again yesterday was the reporter from CBS News. she pointed out that in Trump's video about how great the response was, he skipped the whole month of February, which is the month in which, a critical month in which the administration has been criticized for not doing really anything to stem the spread of the virus. And she kept pointing at it. And Trump didn't answer, but at the end of the day, she got him to a point to say, what did you do in February? He goes, we did a lot, and we'll get you a list. Like that type of stuff, like, puts all that stuff in context. So our jobs as reporters, are to put things in context. And if we're not in the room when we're covering it, if we cover anything, from the White House from that perspective, we just make sure we contextualize it, right? We are the ones who, we have access to the experts who can really tell us, if Trump does have total authority, like he said he did yesterday, and like we are the ones who can put context to that and help readers and help the public understand those things better.
How have you been talking with people and dealing with the conspiracy theories? There's it was developed in the lab in China, and then there's the one that it's the 5G towers.
Yeah.
How can we deal with those things responsibly?
Yeah. So the reality is, I thankfully have not really had to engage in that much. Like I haven't, not too many of the stories or the people I've talked to have been, too much on that conspiracy realm. Not to say though, but I mean, I remember when it happened early on, like we'd, someone internally at the times, we've been having discussions about, one of the early conspiracies that Black people were immune to it, which is obviously not true. And how do we handle that? Like if we cover it, do we then just give credence to something that's, total BS? Or if we cover it, do we then kind of debunk something that's out there widespread? And I think we decided not to do it, but what we did instead was we wrote like the stories about how Black communities can be particularly vulnerable to it, right? Which is one of the stories that I wrote. So I'm kind of like 50-50 on these things. If something gets to a level where, it's just, it's just all over the place and it's a complete false rumor, then yeah, you need to address it in some way. But I think in some instances, the best thing to do is to charge ahead and really cover stuff with accurate and with good information, right? With information that is truthful and that puts things in context for readers and for the public. So I think that is the approach that I think we tend to take. But yeah, I mean, it is a hard call, like how you deal with these conspiracy theories and whether you should give them any oxygen at all.
Is the Black church as relevant as it once was, like say 50, 60 years ago? And if it's not, how else can you get into communities to work that beat, to work sources in those communities?
So you're saying like if the Black church is relevant, if we can't get in through the Black church, how else do you get into communities?
Or if the Black church isn't as relevant, so you're in a Black neighborhood, but not everyone is drawn to the church at the end of the street.
Yeah. So I mean, I guess I'll kind of break that down. So first, yeah, the Black church may not be what it was in terms of an organizing force, what it might have been during the Civil Rights Movement, but it's still a force, right? Like one of my big sources out here in Detroit has been a reverend in one of the communities who they're on the ground every day. They're out there trying to help people every day. So while it may not be as big of a force it was, while people may not be going to church as much or be members of it, there are clergy, especially like kind of reform clergy, who are still very much involved in organizing. And let's be real, if we look at the election, if you look at who helped deliver South Carolina to Joe Biden, which then got him back on the horse and got him to his nomination that he is now, I mean, it was arguably, the Black South and it's Black South Carolinians, and the Black church was, largely behind that. The Black church was still a very big organizing force, and it's still a very reliable force when it comes to getting voters and getting people engaged, right? The Black church is still very big on that. So it's not as big as it once was, but that doesn't mean it's not a force anymore. So I think we'd be underestimating it too much to say that it's not relevant anymore. That said, I mean, there is no shortage of organizations, activists, and people who are very deeply rooted in communities. I think look no further than the Black Lives Matter movement that sprouted from Ferguson. And there you have all sorts of new activists who are getting newly involved in politics and in organizing and whatnot. And I tend to oftentimes I tend to go to both, right? So I'll go to church leaders, and I'll also go to like on the ground activists, and you kind of get perspectives from all of them. You get kind of different perspectives. They tend to point you to different cohorts and different people. And I'll say, in terms of like really getting into communities and understanding what's going on, I still think there's no substitute for just getting on the ground and walking the community and talking to people, right? That's how you that's how you kind of meet people, and everyone always knows something and knows someone who knows this, that, or the other. So I find that getting those leaders are crucial, but you should also I always try to reserve some time to just kind of get in the community and talk to people as well.
So how can sites that aren't necessarily traditional journalism sites, more niche sites, how can they get people to use their platform to lobby local leaders as well as employers to enact safety procedures or mutual aid actions, such as rent strikes or things of that nature?
The question was with how can, like, what types of platform, what types of sites?
More niche platforms, yeah. Journalism entrepreneurs.
Yeah. Well, I feel like, that, because a lot of times change happens on the really hyper local level. So I think in some ways those outlets have in some ways a better access point to be able to get the attention of locals and local authorities, right? So one instance here in Detroit, the mayor last week, he signed an executive order to give hazard pay to the frontline responders, so who work for the city, so police, fire, bus drivers, those types of people, and so those they're very powerful things that mayors and county executives and stuff can do. So I think with those kind of more niche kind of localized sites, I think it's really about telling those stories in the community and getting the community to rally around it, right? Because I think when the community rallies around, that's when you get pressure on public officials, on elected officials. An organization like the New York Times, like, we may not do something that hyper local as much, but like, the stuff we do is it's a similar thing to what we do on the broad scale. So like my colleagues who wrote the great piece over the weekend about the Trump administration's response, and kind of that gets like a lot of oxygen nationally. It captures a lot of people's attention, and I think you can do the same thing locally and then the other thing about locally, you're a part of the community too, right? So use that to your advantage. I come to Detroit now. I know a lot of people here because I've been here a lot. I still have some family here, so I'm able to kind of get in, but I'm still not able to sink in here the way that someone who lives out on Telegraph Road or something like that. I can't get into the community the way that they can. They live it. They live this place. So I think leverage the people your neighbors and your churches, your whatever civic organizations you belong to. Leverage that in terms of getting the story, and two, getting your message out. Like as a local person, you should really be in depth and then really be using that to your advantage.
How do you think this is going to, or do you think this could transform newsrooms? If you think about the social disparities that have just been laid bare, you think this is going to change the way news organizations cover topics like healthcare and housing and employment and poverty? You think it'll change approaches?
Yeah, that's a great question. I guess the first thing I'd say, I hope that it doesn't do too much damage to newsrooms themselves, right? Because this is something we're all living, and we've already seen in Cleveland and in other places where, unfortunately, journalists have been laid off, and then we've seen some unfortunate cuts already. I guess that's the first thing I'd say. I guess in terms of how we cover these topics, I'm not necessarily that hopeful that it would. I'm not necessarily that optimistic, I should say, that it will change the way that newsrooms cover these things. I think good newsrooms are already looking at these things, looking at some of the systemic structures and the systemic inequalities. I think good newsrooms were already doing that. I don't know that this will change it that much, but it could be. I guess I'm typically journalists. We're naturally cynical, so I'm a little bit cynical that it will change that much. But like I will say, stepping back from newsrooms, this certainly has had the impact of getting people to look at the struggle of marginalized working class people in a way that they have not before, I think. So to that extent, I think that, yeah, if it does affect, editors or other newsroom leaders who may not have been thinking about it as much, yeah, then that could have, some sort of effect. How big of an effect it is, I'm not sure. But yeah, I mean, society as a whole, I think, could be changed, or we, again, this time next year, we could have a vaccine. We could, everything could be open. We could all be, and we could just go back to what we were before. Like, people will go back to getting evicted again. Folks will go back to, having, low wage jobs that can't, afford their bills. We'll go back to not having healthcare and having to go to the emergency room every time they're sick. Like, it could all go back to that, like, and I honestly would be like more likely that it's going to go back to that, just because I'm cynical. But like, yeah, I mean, that's how I feel.
Okay. I'm going to look through and see if we've got one last question.
I got one.
Yes, Martin.
Here it is. I wanted to know how the coverage of this story has impacted you personally, John, and your approach to your work and to journalism writ large.
Yeah, I think, well, first of all, this is the first, like, I don't want to say the first, because, obviously, I've sadly had to cover a lot of police shootings and those things like that, where it becomes personal in a way. But this is the first one that, like, really personal in the sense that, when I'm out on the bus in Detroit, like, I'm scared for myself too. I'm not trying to get infected myself. Definitely not trying to bring it home to my wife. And I know she was very hesitant about me coming out here to do reporting. So I think in that way, it's gotten me to think about my own kind of health, both physical and mental, in a way that I don't think I have before. I have thought about it, but just not in this deep of a way. I think I do think it's changing. I've noticed, like, and again, back to my cynicism, maybe this will all be different in a year or two, right? I do sense that the editors themselves have come to appreciate it, because appreciate the needs of reporters, of making sure that we're taking care of, like, again, mentally, physically, and not overburdening us in a way that I don't feel was always there. But I definitely think now, like, I would have no problem talking to my editor and say, hey man, I need a day, like, I need a day, and I think it would be well received. Not saying it wouldn't have been received in the past, but maybe it would have been a more difficult conversation to have. I feel more free to kind of go and do that now, So I think it can change the way that, like, we operate as journalists, and because it's such a high stress profession, right? It's a profession where, you want to be there, you want to be first, you want, during the toughest times for everyone, you got to be, like, running into the the belly of the beast. So I think that's maybe that'll change that a little bit, and kind of give us more of a sense of, like, taking care of our own humanity. I think for me as well, I've always, like, prided myself as a journalist on really understanding and seeing kind of the challenges and the struggles of people who I may not, it may not be my situation, but let me put myself in your shoes, right? And that's always been kind of what my goal has been as a journalist, to help readers, understand, they may not agree with, they may not end up empathizing even, but understanding what someone is going through. And I think for me, that this story is like that, times 100, like, it's really just the pure suffering from people losing loved ones. I mean, the heartbreaking story in Michigan of the woman who lost her son and her husband in 3 days of each other, the story of people, losing work and things like that, and losing all their savings and everything they had, I think those stories, because it's like slowly creeping up on all of us, and I'm blessed, and some of us are blessed and privileged that we're still able to work and make our salaries, and we don't have to worry about how we're going to pay our mortgages or our rents at the end of the month. We're blessed in that way, but I think it's made it more real for people across the wealth and the racial spectrum, the challenges that people have. And I think, for journalism, what that could mean, I guess going back to the last question, is that it could mean, understanding that's part of a dynamic in our society that maybe our viewers, our public, our readers, our listeners will understand better and maybe by them understanding that better, who knows what the impact that could have on our journalism. And just like one example I'll give of that is I did a thing, we did this 24 hours in a pandemic thing for the New York Times, where we interviewed, different people in different places over 24 hours to see how the pandemic was affecting them. And the woman I interviewed, she was a woman who worked at Steak and Shake, lost her job because of the shutdown, and was living out of her car. And since that story appeared in the paper a couple weeks ago or something like that, and then there was the podcast episode was just yesterday, and we have been flooded with people requesting to help her out and things like that. And it's one of those things I remember when I first filed the story, I put on Twitter that one of the toughest things for me is like knowing I'm doing this and then just feeling like, great, like I told her story now, like great, like what so what, like what is that going to mean for her? She's still living in her car after I told the story, but to see, and I know as journalists we're supposed to detach ourselves from this, and I'm not supposed to be the cheerleader for her, but like to see her get all these people coming to donate and coming to her aid, that was like, it made it feel like, it made the story feel worthwhile. It made me feel like I'm not just exploiting her story just to tell a good story, right? Because honestly, like it can feel like that sometimes, right? So I think maybe my perspective is of the power of what we can do, not necessarily to maybe on a 35,000 foot level. Maybe it's not always about changing the law or getting a president impeached or anything like that. Maybe it's just the simple things about like getting a woman a hotel room for a week, and the power that our stories can do that. Maybe that's enough to live with. And I think that's a perspective that I'll always carry with me now.
Okay. Want to be mindful of your time. Do you have time for one more question, or shall we wrap it up?
Yeah, one more is good.
Okay. What are some things that you're tracking to cover with people in communities with people of color as things stabilize? Do you think the inequalities are actually going to increase because of the job loss? Are issues with healthcare going to get worse or maybe get better? What are you kind of gathering thread about that you'll chase once this stabilizes? How do you think this is going to unfold?
Yeah, no, I think all those things, right? Like I mentioned before, I mean, it's about what's going to happen with the economy and the employment. What's going to happen with the inequalities that existed already in the healthcare system? Is this going to be a wake-up call to change, or is it going to be the same? Are people still going to be getting locked up at the same rates? And so yeah, I think that definitely those are all things that we need to look at, and whether or not they'll get better as a result of this. Again, my cynicism tells me maybe we'll go back to business as usual. I don't know. I guess we'll see what happens. But yeah, I think all those things. We need to be looking at the same inequalities we were writing about and thinking about and talking about beforehand. I think these are things that we all need to like look at now in the aftermath of this.
Okay. Martin, would you like to close out?
Certainly, I will. Thank you very much, Gene. Thank you for taking the lead on moderating this conversation. John, I want to thank you for the opportunity. I also want to, and for your work and for your expertise, and for you to be safe out there and definitely take good care of yourself as you're covering this topic. We really greatly appreciate the very practical and specific suggestions that you made here. And to other folks who are on the call, we just want to say that as you think about your work, one of the things that we've been learning as an institute is how journalism organizations, obviously the goal is to spread credible news and information, but there's other opportunities as well in thinking about how you see yourself positioned to community. One of the convenings that we held last year was a convening where we brought community organizers together with journalists to have a conversation about what organizers can teach journalists about rebuilding trust. And so what we think is that there should also be, we should be thinking of ourselves as activists, but activists not in the traditional sense, but activating around news and information, seeing ourselves as conveners, as connectors and facilitators through which we can bring factions and constituencies together. So it's not just about the news and information, which is obviously our primary goal, but it's also about how do we serve in a facilitative role and think about ourselves and organizing communities around good, solid news and information. So thinking of yourselves beyond just reporting, but engaging. So with that, I want to thank my team, the whole Maynard team, for your time, and stay positive, test negative.
Thank you.
Thank you. Thanks, John.
Thanks, Martin. Bye.
Take care, all.